Once again, welcome to Vidya Nagari. This is the third video under the playlist Dental Cementum, and today we will discuss about pulp, its clinical and histological aspects as well. So without further delay, let's get started. Today's topic is dental pulp. Dental pulp is a soft mesenchymal connective tissue occupying the pulp cavity in the central part of the teeth. This is enclosed within dentin and highly resembles embryonic connective tissue. It has a microcirculatory system which retains the ability to form tooth dentin throughout life. The total pulp volume in permanent dentition is 0.3 cubic centimeters with a mean of 0.0. The pulp cavity can be classified into coronal pulp and radicular pulp. Let us come to discussion about coronal and radicular pulp. So, as we can understand from the name, coronal pulp occupies the pulp chamber of the tooth crown. It resembles the shape of the outer dentine and has 6 surfaces, namely occlusal, mesial, distal, buccal, lingual and floor. Projections of the pulp into the cusps are called pulp horns. So it will be equivalent to the number of cusps present in a particular tooth. The coronal pulp constricts in the cervical region, thus projecting as the radicular pulp. Let us now come to discuss about the radicular pulp. The radicular pulp occupies the pulp chamber of the tooth root. It is single in anterior tooth and multiple in posterior tooth, since most of the posterior tooth are multi-rooted. This is more vascular, fibrous and whitish than coronal pulp and protects the neurovascular bundle. This is subjected to reduction as aging of pulp takes place. Let us now come to discuss about apical foramen. Apical foramen is the passage or portal of entry or exit for the pulp contents. Its mean size in maxillary teeth is around 0.4 millimeters and in mandibular teeth is around 0.3 millimeters. Migration or horizontal pressure can cause the apex to tilt, changing the position of the apical foramen than the usual position. The apical foramen is the largest in the palatal root of maxillary teeth and distal root of mandibular teeth. It is located 0.5 to 0.75 millimeters occlusal to the anatomic apex of the root. Let us now discuss about accessory canals. Accessory canals are channels or canals leading laterally from the radicular pulp into the periodontium or periodontal tissue, just like this. It is formed due to premature loss of HERS or HERS. HERS implies 2. Hartwig's epithelial root sheath. We will know more about it when we discuss development of tooth. Broadly classifying, there are 4 zones of pulp. The first being the odontoblastic layers. It is present in the outer pulp with processes in dentin through dentin. It contains A delta nerve fibers, capillaries, dendritic cells. In coronal pulp, the cells are more columnar, have palisading arrangement of nuclei, are 3 to 4 layers thick. And there are more odontoblasts per area in coronal pulp than radicular pulp. The second zone is the cell-free zone. This is also called zone of Wills. This is approximately 40 micrometers wide, relatively free of cells, but is traversed by blood vessels, unmyelinated nerve sheaths, cytoplasmic processes of fibroblasts, etc. The presence or absence of cell-free zone depends on the functional status of the pulp. The third zone is the cell-rich zone. This is present in the subodontoblastic layer, more prominent in coronal pulp than radicular pulp. Contains more number of fibroblasts, macrophages, dendritic cells and lymphocytes. The fourth and the innermost zone of the pulp is the pulp proper, which constitutes the central mass of the pulp, has larger blood vessels and nerves, pulpal cells and fibroblasts. If we are knowing about the pulp, it is very important to know the functions of pulp. The functions of pulp can be broadly classified into formative, inductive, nutritive, defensive, and protective. If we come to the formative function of the pulp, it means pulp tissue induces dentin formation and dentin induces pulp protection. This pulp tissue involves the formation of primary and secondary dentin. Let us now come to the inductive function. The pulp tissue induces epithelial differentiation into the dental lamina and enamel organ. Also, it induces the enamel organ to specifically form a particular tooth. Coming to the nutritive functions of the pulp, we can see that pulp maintains dentin vitality by providing oxygen and nutrients to odontoblasts, provides source of dentinal fluid, nutrition due to rich peripheral capillary network. Next comes the defensive function of the pulp. When the pulp is irritated or injured, it responds by dentinal pain, smear layer formation, tubular sclerosis, then secretions and all. The protective function of the pulp includes recognition of all kind of stimulus or stimuli by the help of sensory nerves. It regulates blood volume and hence intrapulpal pressure. Our next topic of discussion is the aging of pulp. While pulp seems to be aging, there are fewer cells seen. There is decrease in size and number of cytoplasmic organelles. Then there we observe fibrosis and calcifications. By fibrosis, we mean the accumulation of both diffuse and fibrillary components and bundles of collagen fibers usually appear in the aged or aging pulp. Let us now come to calcifications. Calcification is the most common occurrence due to aging of pulp, almost found in 50% of all teeth. Mainly contains carbonated hydroxyapatite crystals in the form of pulp stones, diffuse calcifications or calcific metamorphosis. Now we will classify the denticles or pulp stones. They can be classified according to structure. According to structure, pulp stones can be classified as true pulp stones, false pulp stones, and diffuse pulp stones. Let us first come to true pulp stones. They might be ovoid or round and will contain concentric lamellae. They grow by addition of collagen on the surface of pulp and are usually formed around HERS or Hartwig's epithelial root sheath. It contains dentinal tubules and are found more in root apex. In false pulp stone, there is no rough surface, no surface shape and lamination. It is formed due to mineralization of preformed collagen and is mostly present in pulp chamber. The third category is the diffuse pulp stones. There is no differentiation on calcification in diffuse pulp stones. The next classification is according to location. According to location, pulp stones can be classified as free pulp stones, attached pulp stones, and embedded pulp stones. Free pulp stones are entirely surrounded by pulp. Attached pulp stones are partially fused with dentin and partially fused with pulp. The embedded pulp stones are entirely surrounded. In the next video, we will be continuing about the cells of pulp, circulation, innervation, and effects of dental materials on pulp. So that's all for today's video. If you are watching us on Facebook, then don't forget to like our page